A couple of months ago, I wrote an article on my website about a study that had just recently been published regarding CTE, or chronic traumatic encephalopathy, in former football players. And in that article, I described just how long it took my oldest son Luke to convince me to let him play football, and how, as it turns out, football has been a very positive force in his life, but I still do worry a lot about the risk to his long-term brain health associated with that sport, and how I had researched a protocol of supplements and lifestyle strategies intended to help to offset the effects of potential concussions, or certainly the subconcussive head blows that all football players experience in practice and in games, and how I'd implemented that protocol with him as a preventative measure. And so all along, my focus has been on the risks associated with football. And so it's sort of ironic that a couple of weeks ago I was sort of blindsided by the fact that our family's first concussion happened not to my son Luke, who's the football player, but to my son Sam, who participates in competitive cheerleading. He was at practice when it happened. He and his teammates were practicing a routine in which they do some high-speed tumbling maneuvers and close formation with one another, and he was kicked in the head by another athlete and came home complaining of headache and some mild disorientation. But fortunately, I had done the Sports Concussion Assessment tool, a portion of that tool, at the beginning of the season, and documented his results at the beginning of the season as far as memory tasks, cognitive tasks, balance, things like that. So I was able to repeat that test and found pretty clearly that there were some very obvious differences between his performance on that test that evening after that blow to his head and his performance at the beginning of the season. And so at that point, I felt pretty confident that he did in fact have a concussion. We followed up, of course, took him to the doctor, had him assessed by a physician. Physician assessed him as well and came to the same conclusion that he did in fact have a mild concussion. And we were told that he could take Tylenol for headache. If he had nausea, he could also take medication for that, but mainly we just needed to give it time. He needed to have a couple of weeks in which he was not engaging in any type of athletic activity, no PE at school, no cheerleading practice, no time on the trampoline in the afternoon in the backyard, which was really hard on him. He really hated that. He also needed to rest his brain, stay off his cell phone, not be on Netflix or YouTube or that kind of thing in his spare time. But mainly it was just, we were told, we just need to give it time, give his brain an opportunity to rest. And that's about all that the doctor had to offer for us. But fortunately, as a licensed acupuncturist, I knew that in fact there was more that could be done to facilitate his recovery from that concussion. And so I implemented some of those protocols that I have found to be effective in my clinical practice. And so the good thing about acupuncture is that it's been shown in research on animals to really help in the process of recovering from concussion. We know that in severe traumatic brain injuries, that there's lots of obvious damage to the brain. There's swelling, there's bruising, there's bleeding, that kind of thing. And that's not really the case in concussion. In a more mild head injury like a concussion, really what's happening in the brain is that there's changes to its metabolic activity, there's changes in the way that the brain, the cells in the brain communicate with each other, and those kinds of things. And acupuncture has been shown to help to facilitate recovery in those areas. We know that following concussion that there is a state of oxidation that exists in the brain. Acupuncture has been demonstrated to reverse that oxidative state or help the brain recover more quickly to its normal state as far as that's concerned. We also know that concussion is associated with inflammation of the brain, and that acupuncture helps to reduce that inflammation, that the brain returns to its more normal state as far as inflammation is concerned more quickly when acupuncture is administered immediately after the concussion and then for 3 consecutive days after the concussion. We also know that after a concussion, the brain on its own produces certain growth factors that help to mitigate damage, help to with the rebuilding process that needs to take place after a concussion. But in the absence of acupuncture, the elevation in those growth factors really only lasts for a few hours after the injury. But they've demonstrated in animals that if we use acupuncture, that we can get those beneficial growth factors to continue to be produced in larger quantities for as much as 168 hours after a concussion. So basically what we're doing with acupuncture is really augmenting or activating the cleanup and repair mechanisms that are important following a minor head injury like a concussion. And so kids are able to recover more quickly. Now, acupuncture is not a substitute for conventional evaluation, diagnosis, and treatment of a concussion. In our case, we abided by all of the restrictions that were recommended by my son's physician. We stayed away from PE and from cheerleading practice and from other recreational physical activity for a full 2 weeks after his injury. But we just found that acupuncture helped him to feel a lot better, I think much more quickly than he otherwise would have. It helps a lot with things like headache, also can help with the symptoms that some people have following concussion that include things like insomnia, some emotional ups and downs, things like that. So it was really gratifying for me as a parent and also as a clinician to have a tool at my disposal to facilitate my son's recovery from that injury. And it's something that I like for other parents to know is available to them as well. So thank you very much.